Today, inshallah, we will discuss some of the keys about how to pass in the next MRCOG Part 2 exam, which will be in July 2022, inshallah. My best wishes for all of you. I know that either all of you either going to the exam for the first time or somebody of you tried before entering the exam and entered the exam, but unfortunately couldn't pass. For those who entered the exam before and couldn't pass, I assure you that anybody who starts the way for MRCOG, he will arrive. Sooner or later, he will arrive. So inshallah, as long as Allah gave you life, okay, your destiny is to attend the celebration and the day of receiving the certificate of MRCOG Part 2, So please don't boast yourself. I tried before and couldn't. Yes, as long as you are still trying, you are still on the right way and you will achieve your dream. So never be sad that you tried before and you couldn't. And there is a small point of misunderstanding with some doctors that as long as I couldn't pass, I am not clever. Nobody can say that. Because in MRCOG, not the only target is to have certificates. Okay, if you didn't improve your knowledge and your practice with patients in the clinic, whatever in the private clinic or in the hospital, if your practice didn't change and your practice didn't improve, there is a problem. There is a problem. Okay, because MRCOG is one of the best sources that you can study well, you can improve your knowledge, and you can give your patient the best up-to-date care. Okay, and the opposite is true. If you get MRCOG certificate without changing your practice, there is a problem. There is a big problem. You had a certificate without improving your care to the patient. So make your first target to improve yourself, to improve your career. Okay, that you will learn more and more. In the same time, you have to teach your friends and your colleagues what you learned. So the advantage and benefit is not only to get a certificate, that inshallah you will get it one way. Okay, the advantage to improve and also help others to improve. We have a duty to our juniors and we have a duty to our doctors in our locality. Okay, and even on the internet, you have a duty to improve the knowledge of your friends and your colleagues. Okay, so everyone has a message in his own locality and his own environment. Okay, so let's start. We will talk about how to prepare and what are the steps to prepare for July 2022 exam. So we will explain what about Part 2 and what is Part 2 exam, because some of you didn't enter the MRCOG Part 2 exam at all so far. Okay, let's say a frank point that MRCOG Part 2 is the most challenging part in MRCOG. More challenging than Part 1 and more challenging than Part 3. Part 1 and Part 3 are easier than Part 2 exam. Why? Because Part 2, it has extensive sources of knowledge. Nice guideline, green top guidelines, STRATOG, okay, previous exams, question box, okay, behavior guidelines for HIV, BASH guidelines for infection, FSRH for contraception guidelines, and many other sources like TOC articles, which are very, very, very important. As you see, there is extensive knowledge. And if you make your target to collect sources as much as you can, it will be very heavy duty. And at the end, you will collect 1,000 sources without studying any of them. This is a challenge in Part 2. So what will help you much in Part 2 exam that you are having specific source you are studying from, and this source is well explained, up to date, also summarized and concised, and helps you to understand well when you read it. Okay, so having one source is a good thing to pass this exam, while having multiple sources will make it very, very difficult. So you have to do some effort in Part 2. After part 2, inshallah, the way will be much easier in part 3 exam. And also you can use us in part 3 MRCOG courses. So you will do some effort in part 2. One of the common mistakes in doctors who are entering part 2 exam that because of the duty, because of the work, the clinic, the hospital, and even home duties, they don't study well before the exam. No, this exam needs studying hard, not only to pass the exam. There is also a point of misconception. Some doctors say, if I study question books, if I study previous questions from previous exams that are present already on the internet, I will pass part 2 easily. There is a problem. Let's say that one of the doctors passed by chance, or passed, he was lucky because what he studied came in the exam, and he passed the part 2. What about part 3? The challenge in part 3 is that it's made of 4 trials only. 4 trials only. And this is a stress in MRCOG part 3 exam. That's why it will be a problem if somebody passed in part 2 without having enough amount of knowledge. Dr. Osama, does it happen? Some doctors may pass part 2 without having enough amount of knowledge. Yes, it can happen sometimes. But it will be a very difficult situation in part 3 exam. That this doctor, before part 3 exam, instead of just he will prepare how to perform part 3 exam, how to perform in the questions, how to perform in the stations, he has another big problem. He needs to study part 2 from A to Z again, because he didn't study well before passing in the first time. That's why passing in part 2 with good studying will make it much easier for you in part 3 exam. Studying well will help you to pass from the least possible number of trials. It's not a shame at all not to pass from the first trial. This is a challenging exam, okay? But many doctors, whatever in our courses and even outside our courses, can pass part 2 from the first trial. I passed the part 2 from the first trial. Okay, so take the challenge. You can do it from the first time. Just you need to do your best, you need to study hard, inshallah you will pass from this trial. Another challenge, some doctors entered the exam before. They studied very, very well, but unfortunately they couldn't pass. Yes, you are right. Because studying knowledge for part 2 exam is not the only thing you need to pass this exam. There are many other points. Like what? Very simple things. Sleeping well the night before the exam. Entering the exam with least possible stress. It's just an exam. It's not a matter of paradise or hell. It's just an exam. Okay? And whatever the result of the exam you studied, you improved your knowledge, you became better than before. So why stress? Stress will make it difficult in the exam because some questions in the exam you cannot solve unless you are quite making it easy and your mind is clear and slept well the night before. Okay, all of us tried before to delay sleeping at night when you are studying. What you found? You found that you start to be confused. Your concentration is much less. You start to read things with wrong words. Yes, this is what happens to some doctors in the exam. Do you imagine this? Some doctors, when they enter the exam, they want to sleep. Why? They couldn't sleep well yesterday. So not only studying and good preparation and having good strategy for the exam. So consider, good morning, doctor. So consider this exam as a challenge in every point, in studying, in good preparation, in changing your life and changing your style. Okay? Believe me, whenever you pass part 2, you will be a different person. You will be more clever in your work. You will have more trust in yourself and more self-confidence. All this will help you in part 3 exam. Okay, and doctors who are entering part 2 for the first time, congratulations for passing part 1. Okay, and with us, we can have the challenge of part 2. Another good recommendation for part 2, it's one of the important secrets. Don't walk in this way alone. Be in a company, be with colleagues, be with study partners. This way is difficult if you are alone. But if you are with company, you are all fighting together, helping each other, improving each other, okay, studying together, putting plans. It's something very, very good. It will decrease much stress to be in a company, okay? Because if you are studying alone, you will say, I don't study well, I have much duty. But in the company, you will find all of them also have duties. And you are trying to do as much as you can. It will help you, believe me. So take the challenge and the plan from now to do your best to pass this exam in July, inshallah, in July 2022. It needs hard working and it will be easier if you are in a company. Don't walk this way alone. One of the very good things that we win in MRCOG that we have very good company. And the doctors whom you study well usually will be your friends for life. Okay, because you fought together, you studied together, you try to improve each other. It will be very good friendship for life. Helping each other. Don't be alone. Alone, it's difficult. Okay, so inshallah, the next exam will be in July 2022. Okay, what is my attitude and what is my plan for doctors who are going to join the course? Don't worry, this meeting is for all, whatever will join the course or not. Okay, our plan, as usual, to have 40 online meetings. 40 is too much, yes, because the material is too much. Doctor, can we make it 30? Can we make it 25? Can we make it 20? We will not cover all topics with this plan. I made a survey study before for the doctors in my course. I asked them that there is a new method of teaching called flipped teaching. In this flipped teaching or flipped classroom method, okay, the doctors, I gave them the material before the meeting. They study it at home, okay? Then in the questions. And this is one of relatively new techniques in teaching. Of course, not very new, but it's one of the new. Okay, most of doctors refused. So classic teaching is the best because here you are planning for an exam. Okay, if I gave you the complete freedom, you may spend days without studying. But here you are involved that you have to attend with me twice per week, every Friday and every Tuesday. Every meeting stays about 4 hours to 5 hours, to be frank, with small break in between. So 40 is enough that we can cover all points and we can explain everything. I am explaining from the start, from the basics. Okay, so you don't need to read the guidelines before attending these meetings. Question bank. Every topic, it has a quiz on my website, OSAMAAKL.com. In this quiz, you will solve the questions, then you press finish. It will give you a score and how many questions you solved right, how many questions you need to revise again, and you can check the answers written in the module. So we have twice weekly exams. What do you mean? After every meeting, I give you a quiz about the previous topic. Okay, after solving it, it will give you your score. After finishing the 40 online meetings, which cover most of the curriculum, from NICE, GTG, from TOGS, from BASH, BHEVA, and many others, they are involved. Okay, so don't ask me, doctor, is there a summary for the TOGS? This does not exist. Why? For example, TOG article about PCO. It will be involved and implemented in the meeting of subfertility when we talk about PCO. Another one about abnormal uterine bleeding. It's present in the lecture of heavy menstrual bleeding and abnormal uterine bleeding. So I merge the top summaries in the meetings. Okay. After finishing the long course, there will be a crash course in the last months before the exam. So we can summarize the important points, solve many questions, okay? And explain extra important points in the last months before the exam. Because maybe I explained a topic in January, but in February, the guideline was updated. I should give you the updates. Okay. On my website, there is full study material, PowerPoints, and video recordings. Today, this meeting, after we finish this meeting, it's already now recorded. It will be uploaded to my website. So doctors involved can study from it at any time until the exam. Okay, so video recordings and PowerPoints. And this is a very good point that you don't need to open guidelines at all. You don't need to search for the information. Okay, and very common question I'm always asked, doctor, do you think that the material is enough? It's more than enough. Okay, but study it. Complete studying it at first. Okay, my material is made of about more than 600 and 600 slides. Okay, finish them at first, study them well, more than once, then we can search for other sources. As we said that the sources for MRCOG Part 2 are unlimited, infinity. Okay, every day new information. Okay, even if you finish the basic sources, you can have the extra sources, British Journal, other articles from any UK source. Another important point, in preparation for MRCOG Part 2, don't bother yourself with American sources, European sources. No, concentrate on the British UK sources. So don't tell me that ASRAM said so and so, or American fertility of cycles said so and so. We are here like British doctors. We study from British sources. Don't bother yourself with other sources. Okay. If you open the RCOG website, you will find this table, and it's very important that you consider that your account on MRCOG website is your entry to the new data about the exam and exam preparation. Coming exam, inshallah, will be in Tuesday, 5th of July. So if you start from today, time is very good with you. Okay, even if you are studying from the scratch, no problem. Time is very good. We are talking about 6 months. It's exactly 6 months because today is 5th of Jan. Exactly 6 months, 180 days average. Okay. I should confirm that everybody of you wrote or did expression of interest. It's present on the RCOG website. Enter from your account, open exams, then about MRCOG Part 2, then open calendar and video and venues, then press this button, expression of interest. It will open a new performa. Just you need to write your email, your name, okay, and submit. They will understand you are planning to enter the coming exam, so they can afford you and they will try to afford you a seat in the coming exam. You can do this until before Wednesday, 9th of March. So please do it today, okay? It doesn't have any duties upon you. Just do it now, okay? Today, you have to enter and write your expression of interest that you are planning for the coming exam. Okay, when booking for the exam will open, they will send you an email as long as you made expression of interest. They will send you an email on 28th of March containing a link. So after 2 days, you can use this link to book the exam. Booking for the exam, is it easy? No, it's a challenge. because many doctors are trying to enter the exam. So you have to book the exam in the first minute, in the first second of booking for the exam opening. In the first second, you have to press and book. Okay. Although booking will be open for 2 weeks, but you have to open in the first second, so you can have a place. The exam now, and since the last 2 exams, it's not by physical attendance, it's a remote exam, so on the internet. On the internet, MRCOG Part 3 exams, you can enter the exam from your home. But in Part 2, you have to go to a center called Person View Center. It's a computer center. You will sit on a computer, they will open the exam for you, they will start solving. Okay, and believe me, it's much better than the previous technique that the exam is paperwork. It's now not paperwork anymore. Okay, now it's on computer in Person View centers. Okay, it's more easier, more organized. Okay, it's better than paperwork. So they are good news for you that it's easier. Okay, one of the good things that when the exam was paperwork, you can find full one paper of one question and it's many options. This is difficult technically to be done with computers. That's why exams questions became somehow shorter than before. Before when the exam was paperwork. So it's a good news that the questions became shorter than before. So from this slide, please do the expression of interest today so that you don't forget later and you are not in a problem. Do it today. Okay, this is photo representing what happens in the person view. You are sitting in a computer, solving the exam. Okay, and of course, there are observers. Okay, what is the cost of the exam? It depends upon your country. If UK, this is a fees. If your country, brand A or brand B or brand C. For example, Egypt is brand B. How to know the band? It's present on the RCOG website. Okay, they put a list for countries under band A, countries band B, countries band C. Why? Because some countries, the financial problem is more than others. That's why there is difference between the countries. That's why you have to check what is your country band so you know how much you are going to pay in the exam. Okay. The exam is made of 2 papers, so it's now computer-based. We can say 2 sessions. Every session is 3 hours duration. Every session, you have 50 single best answer and 50 MEQs. What is single best answer? In single best answer, you have a question and you have 5 options. And you have to choose the most right, the best answer among these answers. You mean that there can be more than one answer that is right? Of course. This meeting is for July 2022. Okay, for doctors entering Jan. Okay, after this meeting, there will be the last meeting of doctors entering Jan 2022 exam. It will be the last meeting of the crash course today, after finishing this one, after finishing the orientation session, inshallah. Okay, so doctor, you think there can be more than one right answer? Of course. The name of the question, single best answer. Not single right, single best. So there can be other right answers. While MEQs is more challenging. He gave you many options, can be 15, 20, and even more. Then he will ask multiple questions, and you have to choose among these options. This is more challenging. And always doctors are suffering from this challenging type of questions, which is MEQ. Believe me, if you study well, it doesn't matter if it's single best answer or MEQs. Okay, if I ask you, when our meeting started today, according to UK time, what is the answer? Can you write on the chat? When our meeting started today in UK time, at which hour? Can you write the answer on the chat? Nobody knows? There is chat button in Zoom. Okay, please press it and write when our meeting started today in UK time. If you don't know in UK time, okay, you can write in your local time. Excellent, Dr. Dua. Excellent, Dr. Sally Silis. Excellent. Okay. Does it matter if I give you 5 options and you have to choose 8 a.m.? No, I know it's 8. I will choose it. Does it matter if I made it 24 options and among these options you will choose 8 a.m.? No, it doesn't matter. Why it doesn't matter? Because you know the answer already. But what if you don't know the answer? Yes, here comes the problem. So doctors who complain from MEQ, they have some shortage in the knowledge about this question. Okay, so if you know the answer, it doesn't matter how many options are present. So make your concentration to know what is the recommendation for every topic and what is the best knowledge for every topic. If you know it, it will not affect you how many options are there. Is it single best answer or MEQ? Okay, MEQ is made to decrease the chance of passing by luck. We are not planning to succeed by luck. We are planning to succeed by knowledge. Okay, so every session is made of 3 hours and every one containing 50 single best answer and 50 MEQs. And as we said, MEQs are more challenging. So please start by MEQs first. Can we do so? Yes. You have on the screen of the computer in the exam, you have numbers 1 to 50 single best answer and 1 to 50 MEQ. Please start MEQ at first. Okay, it's present on Facebook Live, Doctor, on my account. Okay, so you can enter my personal account, you will find it. The recording after that to be present. Okay, so you can start by MEQs because they are more challenging. They need more fresh mind. Okay, and another point, they have 60% of the mark in the exam. So MEQ question is having a score and a grade higher than single best answer question. So make your target to pass in MEQs first. So start by MEQs. The RCOG recommends that the 3 hours you spend 110 minutes RCOG recommends that you spend, and this point is important also for doctors having the exam in Jan. RCOG recommends that the 180 minutes of every session, you spend 110 for MEQs and 70 minutes for single best answer. Actually, my recommendation is different. My recommendation is that you make 100 minutes for MEQ. So every one MEQ takes 2 minutes, which is very fair enough. While for single best answer, you give it 50 minutes. So every one single best answer, it should be solved within 1 minute. Doctor, is it important in the exam? Of course, very important. By this, you have 30 minutes so you can solve the unsolved questions. Okay, because you will skip some questions. Some questions you will find it's difficult or not understood. No problem, skip it. After finishing, you will find it became much easier. Okay, doctor, is it important to know how much time I spent? Of course, you have to look at the clock. So the exam starts at 10 a.m. Okay, so please tell me, I will start by MEQ. And we said that MEQ, I will give 2 minutes for every question. So if it became 11 a.m., how many MEQs I should have solved? How many? Can you write on the chat? Can you write on the chat? 30. Excellent. Is it important? Of course. What if you found that you solved it on only 25 questions? So you are slow. You have to increase your speed. Doctor, how we can increase our speed? By reading the question single time. In the exam, there is no time to read the question multiple times. You will read the question once only with good concentration, and you will concentrate upon the keywords. Nulliparous, second stage of labor. CTG still normal, but there is delay. I need instruments. Finished. Highlight the keywords. Okay, and you will read the question once, not more. Okay, what can consume more time is that you read quickly after finishing. I don't understand. I forgot what is the question about. So you need to go to read it again. You waste time. You are wasting time. So it must be read once with concentration and highlight in your mind what are the keywords. And don't read the question in the form of the patient vital signs are blood pressure 150 over 100 and there is proteinuria +2. Don't read it like this. You will read it in the form blood pressure. It's high. This is mild hypertension. And there is proteinuria. It's mild or non-severe preeclampsia. Read it with explaining it to yourself because you will read the question once. Okay, what if at 11 a.m. you found that you solved it 35 minutes, 35 questions, which means you are faster than required. The question, am I solving with good concentration? If okay, concentrating well, continue, no problem. You are a speed person. But if no, I am not concentrating well, you need to concentrate. Okay. So no problem that you skip some questions while solving. It's very easy. At the end, it will give you the number of skipped questions so you can solve them again. Okay. What was the feedback of our previous courses? Okay, I gave courses since 2016, since 2017. Okay, alhamdulillah, many and hundreds of doctors passed the exams from different countries. I always send a congratulations for them on Facebook, and inshallah the same will be done for you. Alhamdulillah, we have friends from all over the world, from Arabian, European, and UK and Ireland, and all countries, and Asia, of course, many friends from Asia. Our new course, it will start immediately next Tuesday, inshallah. As we said, 40 online meetings. After every meeting, I will send you questions or small exam about it, so you have to solve it. Every topic, it has a question bank, okay, with answers, not only questions, with answers. You don't need to find any other source for studying, only you will study from my website. After finishing the long course, there will be crash course. All doctors will have access to the material until July 2022 exam. One of the good offers I gave in this course that if you invite one doctor and this one doctor join the course, you have 100 sterling pound discount. It can be discount in the current course if you want, or it can be discount in the coming part 3 course, inshallah. Okay, so you will have a voucher of 100 sterling pound discount. Okay, if you invite 2, you have 200. If you invite 3, you have 300, and so on. If you invite more than the cost of the course, you will take money from me. Okay. So let's see what will be our meetings. It's every Tuesday and Friday. Friday, exactly like today, we start at 8 a.m. UK time. While Tuesday, we start 11 a.m. UK time. We will be together all Tuesdays and Fridays until just before the exam. Because here, after finishing the long course, we start the crash course, which will be also in Tuesday and Friday, inshallah, until the exam in 5th of July, inshallah. Okay, these are the timings of our meetings. And these are the timings in Egypt time, UK time, Saudi Arabia, Pakistan, Emirates, and Indian times. Okay, our topics, they are many and increasingly always increasing. Okay, systemic lupus, PKU, diabetes, DKA, and pregnancy problems, hypertension, collapse, SCGA, recurrent pregnancy loss, cord prolapse, obstetric cholestasis, thrombocytopenia, RBCs antibodies, cardiac disease with pregnancy. It has full day, preterm labor, psychiatric disorders with pregnancy and postnatal, neurological disorders like epilepsy, headache, and other neurological problems, breech, ECD, nerve injuries, GBS, intrapartum care, instrumental delivery, including also shoulder dystocia, perineal tear repair, cesarean section, vaginal birth after cesarean, and Ogilvie syndrome. VTE, we have 2 green top guidelines, one for prevention, another for treatment, and ovarian vein thrombosis, breast cancer, asthma with pregnancy, appendicitis with pregnancy, multiple pregnancies, skin eruptions, renal disease, liquor problems, amniocentesis, the new one, sickle cell disease, thalassemia, green top and top articles, antepartum hemorrhage, placenta previa, placenta accreta spectrum, postpartum hemorrhage, IOPD, abortion care, reduced fetal kicks, induction of labor, incisions, many talk articles, antenatal care, teaching, thyroid disease with pregnancy, infertility, including hyperstimulation, including nice guideline about subfertility, including many talks about subfertility and PCO management, including also green top guideline about complications of PCO. Contraception, we have 2 days of explaining all points in contraception. Okay, every topic, every method of contraception, it has a topic in these days. Female genital mutilation, menopause, ovarian cyst, whatever in non-menopausal or menopausal women, infections in gynae, infections in obstetrics, including viral, bacterial, and others, including COVID, the Zika virus, and the HIV, many others. Pelvic organ prolapse, laparoscopy, urogynae, including incontinence, including bladder pain syndrome, and BOPQ, and many other topics. Endometriosis, irritable bowel disease, inflammatory bowel disease, irritable bowel syndrome, and hyperplasia, cancer cervix and cervical screening program, endometrial cancer, obesity with pregnancy, and medical ethics, social problems with pregnancy, hysteroscopy, abnormal bleeding, sexual abuse, governance, and intersex, and transgender also, vulva problems, including cancers, autoimmune and others, ovarian cancers, ergonomics in laparoscopy, sepsis, postmenopausal bleeding, thyroid and fertility, and full explanation of statistics. Okay, we have full day for statistics. These are some of the topics we discuss in the course. Of course, as we said, the material is always increasing and always updated. Before every topic, I update it in the few days before it, so any new guideline is already added. Okay, and in the crash course, we revise the most important points and add some small extra topics, which are very important before the exam. I will not read alone. I will not read again. Okay. Okay, alhamdulillah, we have very good success rates in our courses. And doctors who pass, they are very happy. Doctors who don't pass, and of course this happens, are also very happy, and they repeat attending the courses to try again and to improve again and to pass, inshallah. As we said, anybody who started the way for MRCOG, he will have the certificate and will attend the ceremony. Our target is to make it sooner, better than later. This is a screenshot from the website which has the material. It's OSAMAAKL.com. Okay, here's a link for part 2. Okay, and all members in their profile, they have the name of the course. They will have only this one. Where is it? It's in the second screen. Okay. Anyways, they will have a link like this one for the crash course. But if you open this one, it will open all the lectures of the crash course. Okay, like this one. Day 1, the video, then the PowerPoint, then the videos, then the quiz. Okay, it's a screenshot, but this is screenshot for part 1 sessions, and here example for the questions in the quizzes. Okay, the questions, the options you choose, and then you press next. After finishing, it will give you a score, and it will tell you what is the right answer and what is the explanation. We have thousands of questions in the course. Okay, like this one. Okay, it will give you feedback, correct, wrong, how many. I skipped this one because I was giving a sample for doctors. If you press review, it will open again the questions with the right answers and explanation. Okay, for example, this mock exam, it's containing 64 questions. Okay, some nice feedback from doctors in the previous courses. Thank much for all of them. It was the honor for me to help them to pass the exam. Okay, I finished my topic. Okay, we will take a small break. Okay, then we will solve some questions together. Okay, but before that, I need to check if you have a question. Somebody has a question? Okay, you can open your mic if you want. Just please, after opening the mic, say your name and say your question. Somebody has a question? Any question? Dr. Siraj, you have a question?
Yes, Doctor. Speak Arabic, okay?
Okay, no problem.
عندي سؤال في دماغي انك انت لما تنجح في الامتحان عندك نولج كويس لكن ما عندكش سكيلز بحكم الدوله بتاعك ما تعلمش فيك سكيلز في نيور هاند. هل عادي يعني كان تنجح في الامتحان وتمشي غاديك وما عندكش سكيلز يعني يعلموك يعني ولا كيف؟
Okay, so your question about that MRCOG is considered studying written information without having hand skills. This is your question, am I right?
Yes.
Okay. MRCOG is made of 3 parts. Part 1 about basic knowledge. Part 2 about applied practical knowledge. So you will take the knowledge and apply it in your clinic and in your hospital. While part 3 And this is the only disadvantage which is present in the remote form of Part 3 exam. When the exam was physical attendance, he will give you forceps and a doll and asks you to apply it on the doll. This is not done in the remote exam. Okay, but the knowledge in MRCOG, it will be fully practical when you take it and use it for your clinic and for your hospital. It will be practical. Okay, so you will take it and apply it. It's not workshop. You can have workshops for hysteroscopy, for laparoscopy, and others. So you can have hands-on training. And already RCOG is performing already, and it's doing already such method of teaching. You can attend workshops with the RCOG. If you open RCOG website, okay, you will find exam courses and others, open courses. They do courses that you can go and you can do hands-on like laparoscopy, hysteroscopy, and others. But MRCOG itself, no, it's about exams, studying, improving knowledge, so you can use in your practice and having certificates. Because MRCOG itself, you know, every trainee in UK passed MRCOG. Okay, any trainee in UK, they pass MRCOG. How? Because, you know, the training system in UK is made from, after foundation year 1 and 2, specialized trainee years. There are 7 years. To pass from year 2 to year 3, you should have MRCOG part 1. To pass from ST5 to ST6, you should have part 2 and part 3 exam. So in UK, all doctors in the training system who had MRCOG, already they spent 5 years in the training system. Okay, already they are trained for everything. Okay, is it clear, Dr. Siraj?
Yes, it's clear. Thank you.
I encourage you to attend the RCOG workshops. They are very useful. Okay, and you can have hands-on.
Okay, thank you.
Thank you, welcome. Other questions? Other questions? Okay, we will have a small break, 5 minutes. I will not close the session. It will be the same link. I will not close the meeting. Just I will stop screen sharing 5 minutes. Then we continue with solving some questions. Thank you very much. Assalamu alaikum. Okay. Let's see some examples for the questions. Okay, now you can see the question. Please read it well once and choose a suitable answer. Don't worry for the word untitled the question at the beginning. MECDA means monochorionic diamniotic. First, baby cephalic. Second, baby breech. No other risk factors. So the only risk factor here is having twin, first cephalic, and second one is breech. Monochorionic diamniotic. Please, everybody, share your opinion. Okay, the poll will stop on count to 5. 1, 2, 3, 4, 5. Thank you. Okay, here are your answers. Okay, most of you choose induction of labor at 36 weeks, and some doctors chose cesarean section, and only one doctor chose to do ECV for the second fetus. So let's discuss this point. Okay, at first, the mode of delivery in multiple pregnancies. Okay, we can make it in a very well organized way that for monoamniotic twins, delivery from 32 to 33 plus 6. Don't say 34. And at 35 weeks, this is the timing of delivery of triplets. 36 weeks, it's the timing of delivery of monochorionic pregnancy. While dichorionic, diamniotic, they can deliver at 37. Because with di, the risk is less, because every baby is having its own placenta and its own amniotic fluid sac. Okay, I think, doctor, on the mobile, you can swipe the screen to the right or to the left if the question didn't appear. You can try this with the second question. Okay, so in monochorionic, okay, which was the type here, it was monochorionic diamniotic pregnancy, can be delivered at 36. Okay. Vaginal or cesarean, it depends. To have vaginal delivery, we need first baby to be cephalic. Antepartum, I don't care what is the position of second baby. Because second baby, whatever breech or cephalic or transverse, after delivery of first baby, position of second one may change. So I don't care for the position of second one. I care for the position of first baby. I need first baby to be cephalic. As long as first baby is cephalic and no other risk factors, okay, the monochorionic twin can be delivered vaginally. Okay, when at 36. So we can induce labor at 36 weeks. Okay, what about second baby? After delivery of first one, we do ultrasound to see what is the presentation of second one. If second one is cephalic, okay, we can start, we will give oxytocin and we can expedite the delivery of second one. Because some women may have inertia after delivery of first baby. What if second baby is transverse or breech? Here we can try to do ECV. If failed, we can do internal podalic version after delivery of first one. So now she is still antepartum. We can offer induction of labor at 36 weeks because the first baby is cephalic. After delivery of first one, we assess the position of second baby. If cephalic, okay. Otherwise, we can do external cephalic version or plan B, internal podalic version. Okay, so which one is the answer? Induction of labor at 36. To make these numbers easy for you, you can say 32, 34, although it's not 34. It's 33 plus 6. Just to make it easy, but in the exam we know it's 33 plus 6. 32, 34, 35, 36, 37. The worst scenario, monoamniotic. Why? Because there can be problem of cord entanglement. The cord can interfere with the cord of the other babies. They can make knots together. That's why delivery from 32 to 33 plus 6 to avoid cord problems later on. Easy first question. Please write on the chat easy or letter E. Any problem in first question? Is that okay? Easy. Okay, thank you. Second question. Now you can see second question. Talking about 24-year-old pregnant woman. She is 9 weeks gestation. Excessive vomiting. Pregnancy unique quantification of MSS score is 12. Urine ketone plus 2. There is vomiting which didn't improve by home treatment. So home treatment didn't solve her problem. So what can be done? Okay, please, we have 6 questions. Okay, so write on a paper. If you solve first question right or wrong, because I want to collect, because I want you to count how many questions you did well. Okay, I will finish this poll on count to 5. 1, 2, 3, 4, 5. That's fine. Okay, here are the answers. Okay, most of you chose admit to hospital, others chose ambulatory daycare, others chose gave fluids and discharge. Okay, the answer to this question, the patient here is not improved by home treatment. If home treatment didn't help, home treatment means treatment with the community, because this is a treatment prescribed by the GP. The woman can take it while she is still at home. Okay, if home treatment by the routine oral antiemetics is not improving the condition, we can do ambulatory daycare. What is ambulatory daycare? She will come to the ambulatory daycare unit. She will receive IV fluids, IV antiemetics. Okay, then she can go home without staying at night at this daycare unit. If this technique didn't help, next step will be admission to hospital, nothing per mouse, IV fluids, IV antiemetics, and so on. So this woman tried home treatment by the GP and it didn't help. So she can go to next step, ambulatory daycare. Okay, what is the pregnancy unique quantification of MS's scoring system? It's made of 3 questions, asking about severity of symptoms, severity of vomiting, and other GIT symptoms like retching, heaves, and so on. The woman will give a score for every question from 1 to 5. In every question from 1 to 5. So the lowest score is 3, while the highest score is 15. Okay, we classify it from 3 to 6, from 7 to 12, and 13, 14, 15. They are 3 grades. Okay, we can start at first, home treatment. So treatment will be prescribed in the community by the GP. If failed, ambulatory daycare. If failed, admission to hospital. She will stay days in the hospital. And here she will receive IV fluids, nothing per mouse, everything IV, and also thromboprophylaxis. Because admission with hyperemesis, it needs thromboprophylaxis by low molecular weight heparin. Okay, these were your answers. So option 2 is the best, ambulatory daycare. Ambulatory daycare is the answer. Okay, let's go to question 3. Now you can see it. What is the commonest artery that can be injured during entry of primary port? Primary port, which is the umbilical port. Umbilical port. I will stop the poll on count to 5. 1, 2, 3, 4, 5. Thank you. Okay, these were your answers. Okay, so the answer for this question is common iliac vessels. common iliac vessels is the answer. Inferior epigastric is the most common one which can be injured in entry of the lateral port. Let's see this point. This is the aorta, and these are the common iliac vessels. Right common iliac and left common iliac. Okay, here's the level of the umbilicus. During entry, you may injure the aorta itself or the right common iliac. Because you know the aorta is just to the left of the spinal cord, that's why the right common iliac and the aorta are the commonest to be injured during entry of the umbilical trocar. What about lateral trocars? On the right and to the left. They can injure the inferior epigastric, which is a direct branch of external iliac artery. Here external iliac and here inferior epigastric artery. It's ascending upwards between the rectus muscle and the posterior rectus sheath. Okay, so it can anastomose with superior epigastric artery. Very important anastomosis. So during lateral trocar, inferior epigastric. While during umbilical trocar, aorta and the right common iliac are the commonest. We have a talk article about vascular injury with laparoscopy. Okay, so the answer here is aorta and right common iliac. Okay, let's see question. Next one, please write on a paper. If you solve this one, right or wrong, make a score for yourself. Let's go to next one. Question 4. Here is it. You can see it now. Okay, please start. Which indicator that can predict who have the disease and tested positive among who are screened and positive? Deceased and positive among all who are positive. It will stop on count to 5. 1, 2, 3, 4, 5. Most of you choose positive predictive value, which is the right answer, and this is excellent. Let's see why positive predictive value is the right answer. This is 2 by 2 table. Okay. Okay, into the shape. Okay. So the 2 by 2 table is like this. Deceased, healthy, positive in the screening test, and here negative in the screening test. 2 by 2 table must be like this. If it's written by any other method, you should change it to make it like this. Okay, because when you make it deceased, healthy, positive, negative, you can write A, B, C, D. This is the right way to draw 2 by 2 table. Okay, so A, what does it mean? Deceased and positive. So the test was true in this one because positive and deceased, excellent. Okay. B, positive but healthy. So this is false positive. False positive. So it's good or bad? It's bad because it's false. Okay. C, it's negative and deceased. It's good or bad? It's bad because it's a false negative. False negative. While D, negative and healthy, which is good. Negative and healthy. So also we can give it a star. It's true negative. Okay, which ones we love? We love A and D. Why? Because the screening test was true in A and D. That's why we love A and D, and that's why we give stars. We give stars for A and D. They are the best because the screening test was true. Okay, so let's look at A, B, C, D. Which ones of them are positive in the screening test? Positive, this row, which is A and B. A and B are positive. Okay, which ones are negative? This row, C and D. C and D are negative. Okay, which ones are deceased? This vertical column, A and C. They are deceased. Which ones are healthy? This vertical column, B and D are healthy. Okay, if you want to count how many persons participated in this study, you will gather A plus B plus C plus D. All of them together. All of them together. They are the participants. Okay. If you want to know in which ones the screening test was accurate, it was accurate in the stars, in the true ones, A and D. It was accurate. If you want to calculate the accuracy, add A plus D over all. Accurate over all to know the accuracy of the test. Okay. We have things that we can calculate in 2x2 table. We can calculate sensitivity, specificity, positive predictive value, negative predictive value, and many other things like positive likelihood ratio, negative likelihood ratio. To make it easy, we say that this vertical column is the one of sensitivity. This vertical column is the one of specificity. This transverse row, it's for positive predictive value, and this transverse row is for negative predictive value. Very easy. Sensitivity, specificity, positive predictive value, negative predictive value. Okay. Why we put the stars? Always the stars are above. Okay, so in the equation, the star, which is A or D, should be above. Okay, let's see the equation of sensitivity. The star over all. Specificity, the star over all. Positive predictive value, the star over all. Negative predictive value, the star over all. So one equation for all of them. The difference in the items in the equation. The star here is A. So A over what are all? B and C. Specificity, where is the star? D. What are all? B and D. Clear so far? Clear so far? Okay. Positive predictive value, what is the star? A. What are all? A and B. Negative predictive value, what is the star? D. What are all? C and D. So these are the equations. The question was asking about the deceased and the positive among all positive. Where is the deceased and the positive? A. among all positive. Here are the positive, A and B. So which equation is it? It is the equation of positive predictive value. Positive predictive value. You can be asked about other equations, but it's very easy. If you know the table, you don't need to memorize by heart, but you know how to make the table, you can extract anything from this table. Okay, so next question. Question 5. Here is it. Which gestational age, if the pregnant woman stopped smoking before this gestational age, the baby will not suffer a problem? Before which gestational age, if the woman stopped smoking in the antenatal care, the baby will not suffer harm? Participate, try. Even if you don't know the evidence, try. We will stop the poll on count to 5. 1, 2, 3, 4, 5. Thank you. Okay, most of you chose 12. The right answer, according to the TOC article about smoking with pregnancy, said if the woman stopped smoking. Here are your answers. The TOC said if the woman stopped smoking before 15 week, the baby will not suffer a problem. So 15 is the right answer. 15 is the right answer. Okay, please mark, give yourself a score. Next question, question number 6. Here is it. A statistician collected data by doing a questionnaire among girls to find what is the prevalence of a disease. He wants to know to what extent this disease is common among this group. He wants to know the prevalence. Which type of study he will use? He wants to know the prevalence. So he will count how many deceased among all the group. The poll will end on count of 5. 1, 2, 3, 4, 5. Okay, what if we add another option of none of the above? Anybody was going to choose none of the above? If there was an option of none of the above, anybody was going to choose none of the above? No one of them is the right answer. There is no right answer here. Okay, always memorize. To know the prevalence of a disease, we use cross-sectional study. Cross-sectional study. So let's see what are the types. So you will not be graded for this question. Don't worry. Okay, so it's a tricky question. I was expecting that to tell me there is no right answer. Yes, there is no right answer. Okay, let's see what are the types of studies. We classify the studies into either descriptive or analytic or interventional studies. Okay, and the commonest types in the studies are Cross-sectional. Cross-sectional. Cohort. Case control. And another specific type, which is RCT, randomized controlled trials. If you are searching for a prevalence of a disease, you will choose cross-section. Prevalence. Specific. Prevalence equal cross-section. So he will count how many patients among the group. Thank you. It's a prevalence. And this is the answer of the question. Cross-sectional study. Cohorts. It's a difficult one because it will take much time. So we are following a group of people having same criteria or having exposure to a risk factor, like group of smokers, for example, or group of deceased people, and we will follow them in the future. Usually prospective. Single group will be followed in the future. Case control, we have two groups. One deceased and one healthy. And I will compare between them. How many of them smokers, what is BMI in every group, and so on. I am comparing between two groups. Comparing, so asking questions about the past. So usually retrospective. RCT is the one used to try a new drug. Okay, so I have two groups of people. One will receive the drug, and another one will receive placebo or receive the golden standard medication, and I will follow them to see the efficacy of this new drug. Can they be more than one group? Of course. You can give drug, placebo, and another drug, another old drug, or another new drug, no problem. For example, BCO comparing between clomiphene versus metformin versus placebo to see which one is more effective. Okay, so this is simple explanation for the basic types of the study design. So in the question, there is no right answer here. Okay, so it's cross-sectional study. So there is no right answer among the options. So who chose any one of the four options? Do you have explanation for your answer? Okay. Let's go to next. Or this was the last one. We had question 5, we had question 6. Okay, we finished the questions. So we will give a score for the 5 questions. There is no score for the question about cross-section. So please, you can now press annotate. It's present in your screen, annotate, and write on the screen from 0 to 5. What was your score? How many questions you solved right? You can write on the screen, score from 0 to 5. You can annotate. There is button for annotation on the screen using your finger or using the mouse of the computer or using your finger on the screen of the mobile. Yes, 4, thank you. Who else? One, okay. Who else? 3, okay. 3. 1, 1, 1, okay. 4, okay, that's fine. 0, no problem at all. Okay, as we said, we are starting from the scratch. 4, okay. Okay, and on the chat, 4, 3, 3, 3. Excellent, 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 no problem. 4, excellent. That's fine, okay. Yes, we have here more than one doctors, they scored 5, which is excellent. Okay, 3, very good. Okay, whatever the score, it doesn't matter. Okay, always think that with every day you have to learn something new. And also you have to teach your friends. One of the very good methods of learning is to teach others. That's why study group, you will teach them and they will teach you. You are improving much each other. Okay. So thanks much for participating in this interactive session. Okay, so we finished our meeting today. Please, if somebody has any question. Any question? Thank you. For course members, we will start, inshallah, our next meeting, okay, in the next Tuesday, 11 a.m. UK time. We will talk about phenylketonuria and systemic lupus erythematosus with pregnancy. Daily 1 hour meeting. Daily 1 hour meeting. Okay, no, it's better that you plan your timetable, that you have 2 days, that you are sparing some time for the meeting. Okay, but daily, nobody can save specific time daily. It's very difficult. Okay, my timetable, that it's every Friday and Tuesday, it's since 4 years or more. Okay, so just you can arrange your time, and if any doctor missed any meeting, you can watch the video on the website. Yes, our next meeting will be immediately next Tuesday, inshallah. Okay, which will be on Tuesday, will be on 11th of Jan. 11th of Jan. The problem that the time between Jan to July exam is short, while the time from July exam to next Jan exam is long, because July exam in the first of the month, while January exam at the end of the month. Okay, timetable, yes. All members of the course, already you have access to the website. Okay, already you have full recordings of the last course. After every meeting, I remove the old recording and upload the new recording. But already you have full timetable of the 40 sessions. So we didn't study subfertility yet, but I have a case of subfertility. I want to know what is the evidence about it. Okay, open the website, go to subfertility, watch the video. It will help you until we explain it. Already all the recordings are uploaded within the last few months. Okay, as you see, the course is a cycle made of 6 months. So all the data are updated. Okay, thank you very much. Please, for any question about details of the course, you can contact me on the WhatsApp number. And this is my WhatsApp number. Okay, this is my WhatsApp. I am the one who replied to this number. Okay, and thank you very much. Welcome. Best wishes for you all. Enjoy your journey to MRCOG. It's very useful in every aspect. Thanks much, and Assalamu alaikum.